Okay, welcome everybody. And this is the PCOS Collective info session. So we're going to be going through everything that you need to know about the program, what to expect, the timeline, and then a little gift at the end for all of you who have attended today. So what we're going to go through, like I mentioned, what to expect, the session details, also a little bit about myself and why I wanted to create this program, and then a little gift at the end for those who have attended today and will sign up before the promotion ends. So there's a little gift at the end there. Now, throughout this presentation, if you have any questions, just throw them in the chat. I will most likely get to them at the end when we go through the Q&A, just to make sure that we can go through the chat and make sure all of the questions are answered. This is going to be recorded, so for anybody that wants to go back to the content, no problem, you can do that. And then for anyone who has not attended live, you'll be able to access the recording long-term before you sign up. So there's that. I am Dr. Jessica Nazareth, and I have PCOS myself, so this is a really big reason why I wanted to create a program for you all, just kind of filling in the gaps of what I've noticed with my own PCOS experience, and then also the countless of patients that I see and what they've been experiencing, whether in the medical system or even just trying to navigate PCOS in a more confident way. I see strictly reproductive health in my practice, so majority of my practice is PCOS, I would say about 70%. And then I see things like PMS, pelvic pain, sexual dysfunction, vaginal infections, and things like that. So that's a little bit about me, but I will get through a little bit more about my why when we go through why I created this program. Diagnosed as a teenager also meant that I didn't have a lot of access to the information that we have now, but the caveat to the information we have now, if many of you have experienced, is there's so much information that it's hard to navigate what is true and what is false, and where to even begin when it comes to treatment and testing and things like that. So that is kind of where this program came to fruition. So this is kind of a mood board that I created to kind of get a grasp on what things could feel like when it comes to PCOS. So with PCOS, there can be a lot of stress and mental emotional components to this condition. And that is because, number one, we are often feeling a little bit dismissed by our healthcare providers. So a lot of people take years to get a diagnosis in the Canadian healthcare system. And I'm sure that's not super different to other countries, but that is the stats with us. It could take up to 5 years for a PCOS diagnosis. And so it really is something that we are left kind of just trying to figure out where these symptoms are coming from and what they mean. The other part of it is some of the symptoms can create a bit of issues with our self-esteem, our self-confidence, our relationships, things like libido, those types of things. And that's very clear in the research. Anxiety, depression, and mood issues are very common with PCOS. So all of that to say, there is very much a part of it that we want to be able to create a level of community healing, which is a huge part of this program. What we know is that those who have chronic conditions like PCOS are able to actually have way better improvement in their symptoms, whether physical or mental, by joining community support programs. And we're going to go through why, but a huge reason here is that throughout what I've seen in practice, there's a lot of gaps in terms of what we're able to provide one-on-one. This program will really be a place for you to not just connect with one another and resonate with each other in terms of what experiences you have been having, whether in the medical system or just with your symptoms in general, but to feel empowered. So we're going to go through different topics each week so you understand your condition, understand testing and how to read your results, which are very different to what you might be experiencing in a conventional medical system. And then also treatments and therapies and things that we need to consider throughout each stage of your journey. As you can see on this side, kind of envisioning what we're hoping to achieve. So, positive relationships with foods and understanding that restrictive eating is not the end all be all when it comes to PCOS treatment. Knowing that you can advocate for yourself with your medical provider. That is a huge, huge part of reproductive health because there is many gaps in terms of treatment and understanding of these conditions. Being able to feel more confident in your body, but also feel more confident in the diagnosis of PCOS, being able to connect with one another and know that you are not alone on this journey. It is the most common endocrine or hormonal condition that we are faced in reproductive health. So there are so many of us navigating this challenging diagnosis. So, what is the PCOS Collective? So, the PCOS Collective is an 8-week virtual program. It's aimed at empowering anyone with PCOS through education, community support, and information around treatment and management. So, we are really going to be focusing on empowering you with understanding your diagnosis and how to manage your symptoms. But more importantly, really trying to figure out what are the challenges we are dealing with to achieve our health goals. That's another piece here where we're really going to be checking in on health goals each week and seeing what challenges are coming up so that we can talk as a group and support one another in those various areas. Each session, we're going to be going through specific topics, which I'll go through in a second. So the educational content, we have interactive discussions and practical tools and resources to be able to apply each week. So really that combination between education, community support, and then check-ins with me every week for those 8 weeks. Going through some of the topics that we're going to discuss in the program. So first of all, we have the intro session, and this is going to be where we are going to talk about the program, get a little bit of an understanding of the generals about PCOS, and most importantly, just talk about some goals that we can all set for ourselves. That's going to be a really big part of that first session so that we're all on the same page and are actually setting attainable goals for ourselves so that we can actually feel like we are accomplishing something each week. The second week is going to be going through your diagnosis, understanding what PCOS is. It is a syndrome, so it shows up really, really differently from person to person. So really understanding what are other diagnoses that we might need to inquire about, and just making sure that we are able to understand what testing means and all of that, which will come at week 3. Now, testing is really important because I'm not sure if any of you have worked with a naturopathic doctor before, but if you have, you're probably pretty aware that the way we interpret lab tests are very different to the conventional system or what like a standard life labs or situation in other labs, if you're coming from outside of Ontario, might be interpreting it as. We look at optimal versus normal. And so we'll be able to go through specific tests that would be recommended for PCOS. And what are those optimal ranges? How often should we be getting tested? Those types of things. And then navigating the medical system. Many of us have experienced like a transvaginal pelvic ultrasound for diagnosis, potentially understanding how we can make those more comfortable because oftentimes we are going for follow-up testing with that. Also, just navigating the medical system in terms of advocacy, which is a big part, like I've mentioned time and time again, just understanding what that looks like and how to integrate a more natural approach with the medical system. The root causes of PCOS is going to be a big week where we're going to discuss the main root causes of PCOS and symptoms and signs that you might fall under those specific root causes and what to look for. Week 5, stress is a big, big one. So for me, stress is huge, and that is impacting symptoms for many of my patients when it comes to the maintenance of their health goals. So we see people getting really, really, really good results, and then all of a sudden there's a stressful event in their life, or there's a loss of a job, or something shifting with their family dynamic, and all of a sudden all those symptoms come back. So that's going to be a really, really key week where we're going to be talking about stress, how it's impacting our hormones, our androgen levels, so like testosterone and things like that, that could be causing acne, hair loss, hirsutism, or their hair growth on the face and body, and how to better manage it more long term. And then body image and self-care. So this was one that I really wanted to include because it is really important that we are talking about our relationship with not just our health, our body, our mind. Typically, when we go to a conventional doctor, we might have heard that to treat PCOS, we have to just lose weight. And while weight loss resistance might be a goal of yours, it is not the end all be all when we look at metabolic factors. So we want to make sure that we're not just minimizing things, we're understanding our relationship with food a little bit better. We're understanding our self-confidence a little bit better and understanding how we can manage our symptoms in a way where there's less shame around it, which can come up a lot of times with PCOS. I think there is just a general misunderstanding about the diagnosis and also just a lack of understanding when it comes to the conventional side. There's also just a limited amount of time that they have with their patients to really be able to educate them. So this will be a really good time to ask your questions, make sure that you feel like you have some clarity, and then we can kind of go deeper into it each and every week. And then week 7, we're going through lifestyle changes, which is the foundations of treating PCOS. So this is really going to be talking about lifestyle, the research around diet, which is super important. I'm sure many of you have seen a lot of restrictive diets online that you have to cut out carbs, that you need to cut out gluten and dairy and all of these things. There's so much information that it's hard to figure out where to even begin. So we're going to go through the basics, the most up-to-date, evidence-informed lifestyle changes, and how to start implementing them that week. Throughout this, there will be little blimps of supplements, but keep in mind, because this is an educational program, it is not going to be direct one-on-one individual care. So it's not going to be targeted to you, but we will provide the research to support specific supplements each week. So we might go through some during the root causes of PCOS, definitely around stress, and then looking at lifestyle changes and things that can support it, both supplemental, whether that's herbal medicine, nutraceuticals, and maybe other modalities that can be thrown there in there as well. And then week 8 is going to be the wrap up session. We're going to be talking about next steps. We're going to be revisiting our goals and talking as a community to make sure that we feel ready to take on the next course of action in terms of PCOS treatment. Okay. So what will you be getting? So each week you are going to have a 1-hour session with myself where we're going to go through the topic, the content, check in on those questions that came in from the week before, and ensure that all of your questions are answered each and every week. So you can see that we're going to have anonymous question and answer options and then weekly community discussion forums. This will allow us to stay connected to one another, but also be able to ask questions that you might not feel comfortable asking within the actual live sessions. I will take a look at that before every week and make sure that those are where we start with each session, just ensuring that your questions are answered and we can get some it's really focusing on clarity, really. So any clarifying questions that you have about the content or even things that you're seeing online. Maybe you scrolled across a TikTok or a reel or a video or a blog saying something about PCOS and you want some clarity. That is a great spot to just throw your questions in so we can get them answered. You're also going to get access to the PCOS Collective workbook. So that's going to be something we're going to be working on each and every week. Going to be some activities, some interactive components, ways to really apply the knowledge and information into your day-to-day. And then I'm also going to provide the opportunity for there to be some accountability partners if you're open to that and if that's something that you want. Again, what we know is that through community support, we achieve our health goals easier and more efficiently. And so for some people who might have been treating their PCOS for quite some time, that accountability part can be really, really helpful because we're able to see what are those challenging parts of treatment that we're struggling with. Are we struggling with implementing diet? Is it movement? Is it sleep? How can we support one another to get there? We can learn a lot from one another. And that's kind of the big thing about this program that sets it apart from any PCOS program that I've come across up until now, which is that community setting and community healing. The other pieces is just access to other resources. So again, if you were to ask questions in there or just like trying to figure out if there's practitioners you want to look at, I'm going to come up with a list of practitioners by the end of the program just to make sure that I can have time to discover where you are all coming from. If I can't work on with you one-on-one, if that's something that you're looking for, how can I provide you with practitioners who are equipped and knowledgeable with this area of healthcare? And then the last thing is just you'll have lifetime access to this content, which is really cool because you'll be able to go back to the community discussions. Although they will be closed by the end of the 8 weeks, you can refresh your memory. Maybe people ask questions that you also were wondering but didn't have a chance to go through. You can go through all the recordings, the workbooks, all of that will still be available. And in the future, if I ever launch any other PCOS Collective offerings, I know some of you are coming from Toronto, so let's say we did an in-person event, you will be the first to know about those offerings and what that looks like. Okay. So the who. So we got a lot of questions in our emails around who is this Collective for. Really, it is for anyone who is on their PCOS journey, whether you've been recently diagnosed, you're in the process of getting a diagnosis, or you've been diagnosed for years. And the reason being is because at every point of that journey, there are things that we can provide to help that become a little bit more empowered and a little bit more well-informed. There is a huge place of education in the reproductive health space, including PCOS. I think we can all agree that our education around our reproductive health was pretty minimal, if any. And then when we have the added layer of being diagnosed with something like PCOS, we're not necessarily given a lot of information. We're challenged to go online and try to figure it out ourselves. And with the bombardment of so many different content creators and things online, it's hard to really navigate. So really, this is a place for anyone at any point of their journey. Now, for those who are seeing a naturopathic doctor, the way this PCOS Collective can really support you in that journey is in two ways. Number one is if you're currently in active phase of treatment, this can offer a space of accountability, community support, and education. As you know, the one-on-one visits, they're much longer than what you might experience with a medical doctor, but they aren't necessarily long enough for us to go deep into the education and empowerment side of things. So there is that. There's also a level of those who are in more of the maintenance stage of their PCOS journey with a naturopathic doctor, a functional medical doctor. And this can really offer a space of coming back to your goals and coming back to these key pieces of information to be able to really take those next steps and create sustainable changes. Now, it's also great for those who have limited finances right now, who are seeking support for their PCOS, because working with a one-on-one practitioner can work up to be thousands of dollars. And while that ends up working out to be really, really impactful and can have really great changes when we're getting individualized treatment, this is a great place to start and can set you up for achieving those health goals in different ways with or without a practitioner. And then long term, you can then take your information and when and if ready, can take the next step and have a little bit more of that individualized care. And then the last thing is for those outside of Ontario. So as a clinic who has a lot of a PCOS focus, and myself seeing a lot of PCOS and having PCOS myself, I get a lot of inquiries outside of the province. And so because I cannot treat one-on-one outside of the province, this allows you to still engage with the clinical expertise, understand your condition, and be able to get a little bit about how we as a clinic and as myself focus and treat and manage PCOS as a practitioner. So that's kind of the gist around who it is for. And where will it be? This is going to be strictly virtual. So this is a virtual workshop all through Zoom. So similar to this, you'll get a weekly Zoom link. And then there's also going to be a platform available for you at Thinkific. I'm not sure if any of you have used that platform before, but it is a place where we will be able to access your recordings, your workbooks, the community discussions, and the anonymous Q&As that will all be in that portal for you. It's a private portal just for the those joining the PCOS Collective. And the when. So we are starting on October 1st. It's going to be the Tuesday of every week at 6 p.m. Eastern Standard Time. Now, keep in mind, obviously, attending live really allows for that community support to be maximized, of course. But if there's weeks that you aren't able to attend, you will be able to get in on the recordings. And the good thing about the community discussions is it still offers a place where you can get that community support just in between each session in case you aren't able to actually attend live. So these are the dates that are there so that you can have a little bit of an idea of what it's going to look like. Now, this is kind of a little bit about my why I developed this program to begin with. I touched a little bit on it, but a few things that I wanted to go over. So what we know with PCOS based on stats is 71% of those with PCOS are experiencing feelings of loneliness and really struggling to find people who are going through their same struggles or even just understanding it. And I'm sure a lot of us can resonate with that in some way, shape, or form. Sometimes it's a little bit difficult to explain to our friends, our partners, our family, our doctors of what it really feels like sometimes to deal with reproductive health concerns like PCOS. And so through the support, again, like I mentioned, through group health and support groups, it ends up helping you with your stress levels, number one, feeling supported, but also with your physical and mental health symptoms. They actually are much more effective to do group healing groups in that setting. For accountability, yes, but again, just feeling connection through the community health support, and then also support, of course, as I will be there supporting you, and then the whole group of us will also be there as well. I am keeping it pretty limited in terms of the amount of people that we're accepting this round, just so that it feels cohesive and small enough where we can connect and really feel like it's not too many people in one room, but rather a small, cohesive, integrated community. The accessibility part of it is being able to access the content virtual is a huge part of this as well. Being able to access the education, the empowerment, and support no matter where you are in the world. And if you aren't able to attend the sessions, again, like I mentioned, they will be available virtually and on the recordings in your Thinkific portal. And then the empowerment phase. So that's a really, really big part. So education is one of the principles of naturopathic medicine. It's honestly a huge reason why I got into the field. I do believe that education, empowerment, learning about our bodies, body literacy, reproductive health education can go a long way to helping us make sure that we are getting diagnosed properly, but then also managing our symptoms effectively. Things like understanding our periods and our cycles and tracking things around our diet and lifestyle and movement, all of those different things that can really empower us to figure out what is working for us, what is not working for us, and what would be the best course of action to start dealing with those symptoms. The thing with PCOS is yes, there are symptoms, but there also are complications that we want to prevent. And so things like blood sugar dysregulation and diabetes risk, we look at cardiovascular health, we look at fertility, we look at all of those different pieces that are not guaranteed to happen. It's just more so through education, through empowerment, through lifestyle changes, through these different approaches, we can actually prevent those things from happening. And then the affordability perspective, like I mentioned, compared to one-on-one, this is a great option to engage in just to make sure it's more accessible for people as well. So this is what I was mentioning in terms of the end of the presentation. There is a limited time discount. So right now we are offering the program for $50 off until Monday. Because you are going to be part of the very first round of the PCOS Collective, this is going to be the lowest cost it will be. So joining the call today is great so that you can make your decision and just try to figure out if this is the right program for you as soon as possible so that you can get in on the lowest rate that will be available. We have a limited spots, like I mentioned, so I will only be accepting 18 people. Currently, we have a few already signed up. So within the next month or so, we will be closing the doors once that number is hit. And just keep in mind that with 8 hours of one-on-one care with myself, it can cost over $1,600. So with the program, we're offering it for $527 until September 16th, which is on the Monday. And then after that, it will be going up to $577. So that's kind of the gist around the program. So it works out at that $527 rate to be $65 approximately Canadian per session, which actually is really, really a great thing because one-on-one care can work up to be over $200 per visit. So this is a great chance to not just get the information, not just get an understanding of your condition and the symptoms and the treatment, but really do this in a community setting, which oftentimes leads to a lot more sustainable and supported goals. So that is the end of my presentation. So I am going to stop sharing and then we can go through any questions that you have if there are any. So you can either throw them in the chat or you can take yourself off mute and then we can go through them.
Hi, Jessica, one question.
Yes.
Is the program, I think I know the answer, is the program like can I charge it to insurance the way I do for like general one-on-one sessions, or that's a different, it won't be accepted?
So because it's not individual one-on-one care, it won't be applicable to like a general naturopathic coverage. However, if you have a health and wellness plan, sometimes those are able to cover programs like this one. It just won't be able to go through my license ID because I'm not seeing you one-on-one. Does that make sense?
Yes. Okay, perfect. Awesome. Thank you.
Yeah, no problem. And just so everyone knows, if anyone was late, we're gonna put the recording up tomorrow. So you'll get an email like you got today, and it'll send you the link to the recording just so that you can review what we've talked about as well. And then I am going to just throw into the chat the link to sign up as well, just so you have easy access there. Give you guys a couple more minutes to see if there's any other questions. Otherwise, we'll wrap up. And if anything comes up for you along the way, you can email our clinic. It's just info@theclaraclinic.com. Yes. Yes, I'm very excited about that part of this. I would love at some point to offer some in virtual option or in-person options as well, just to create that community setting. But this is a really, really great opportunity. I've seen some pretty amazing results through community health. So yes, I'm very, very excited for that part of it. Yes, 100%. I think weight loss resistance in PCOS is a massive part of why I wanted to create something like this, just because there's so much information online. And then we're also receiving pretty poor support and information from our medical providers, assuming that PCOS is just going to be cured through weight loss. And it's so much more than that. And we want to make sure that that is discussed, because so many of our concerns as women, as anyone who menstruates or has ovaries, we are constantly being minimized to it's in our head. It's just the weight. It's just this. It's just stress. And oftentimes it's so much more than that. So being able to kind of share our stories, there's so much healing that can come from that. And then having a bit more of an informed and evidence-based approach to understanding your condition and how to treat it is really my hope that you will all get from this program. So yes, that is a really, really important part. Okay, so I know we ended early. Like I mentioned, if you have any other questions, feel free to contact us. I will just quickly throw that into the chat for anyone who has any further questions. Otherwise, don't forget that we have the promotion that's going to be going on until Monday. And then afterwards, the prices will go up, but it still will be the lowest cost that we will be offering this program until we offer it next in 2025. So thank you so much for taking some time out of your Monday evening just to get to know me and why I created this program. And I hope to see some of you in the PCOS Collective.